Yeah, so I graduated from Nightingale in December 2019. I quickly took and passed my NCLEX, and then I started as a nurse in February. I had a few good weeks of normalcy, as normal as being a new nurse can be before COVID-19 hit. So I was originally hired to do acute care, that's medical, surgical, and quickly realized that they needed me more in the critical care setting due to all the critical patients coming in. So it's been a lot of back and forth and learning a lot at this time. I'm learning alongside with the providers and more experienced nurses on the best way to care for these COVID patients. So, it's an exciting time. It's stressful, but I am excited to see, what experience I take out of this and where it takes me in my career. Yeah, the ventilator concern across the country is definitely one that, a lot of people are worried about. Luckily, we have not been hit as some of more of like the hot spots in our country. And as far as I can see, we've maintained enough ventilators for our patients at this point in time. And, my hope is that, we never have to get to that point where we're having to pick and choose which patients we have ventilators for. Caring for a patient with coronavirus is, it's kind of like a tough question to answer because every patient presents with different types of symptoms that we have to treat. The vast majority that have to be hospitalized have respiratory components. So we focus more on, making sure that they're getting enough oxygen, and then at the same time, whether other issues like fevers and if they need antibiotics due to, secondary infections that go on. So there's really not, I think that is a question everyone wants to know is how to treat these patients. And it's not a one size fits all. So what I wish people knew about this COVID-19 is that it's not like the everyday virus that we see. It's not like the flu. It affects people, there's, a lot of people it won't affect that much, but then there are certain people that it can be, deadly. So I wish people understood that it's a lot more serious than what, some people think. And as a way to help, just follow precautions, stay 6 feet apart, wear your mask in public if you feel you need to, wash your hands, just all the typical recommendations. It's recommended for a reason. It's because it's helping, and we need to keep the curve flat. So the way that the communities can help nurses at this time, not just nurses, but the doctors, the respiratory therapists, all the other frontline caregivers, is to just abide by the social distancing. Do your part. We're doing our part. We need everyone else to contribute and help us out just by following the restrictions. That's about what the community can do for us right now. Some of my biggest concerns for the nurses over the next couple of months, beside from the obvious skin issues from our masks and our other personal protective equipment, is just burnout. We're getting burnout, and it's not from we are getting overworked in some instances, but it's just the constant change, the policies and what's recommended. It's always changing. It's tiring, and I'm worried about burnout. Some positive things that I hope we get from the situation is, I hope that it helps us all slow down a little bit. I feel like right now, before this, everyone was go, 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 go all the time. And, I've enjoyed some slowdown in my own family. And I hope that, this just makes people appreciate other people more and being outdoors and family. Why I chose to become a nurse is, I talked about I love patient care and the acuity that bedside nursing brings, but I also, money's kind of a taboo to talk about, but I also wanted a career that I not only enjoyed, but that I could support my family. What I find rewarding about being a nurse, it's endless, it's just like the simple thank yous or, giving these patients hope, someone to talk to, someone that's gonna listen and just be there for them at their most vulnerable moments. It's a great thing to be a nurse. How I deal with someone that's not satisfied with my patient care. Unfortunately, we deal with this all the time, especially now with all the COVIDs where we're not allowing visitors and things like that. All you can do is explain the best you can on your reasonings for doing things, and you can't please everyone all the time, and you kind of just have to, let them know. They can talk to supervisors, they can talk to managers, but ultimately I can only do what I can do. My greatest skill as a nurse, I feel right now, is just being flexible. Like, I have learned really quickly how it takes flexibility to be a nurse, and you know, you have to just go with the punches, go with the flow, and just take each day as it comes. There's no standard to nursing. You're not going to get a certain like patient load or, you know, patient case like every single day. So you kind of have to just learn to be flexible. How do I handle stress on the job? It's a lot of Diet Coke. Not gonna lie, whenever I have stressful days, and there's some days I do want to cry and I'm overwhelmed, I lock myself in a room with my Diet Coke, sometimes a pudding, and I just eat away my feelings and then just come back with a big smile on my face.